I was having really bad suicidal ideations at the time, and I went to my doctor. I just drove there one day and I was like, I'm gonna do something bad. Like, I can't live like this. This is horrible, and I can't do this anymore. And he just said, oh, it'll be a year-long wait until you can see a psychotherapist.
I find that fascinating that you said doctors were saying you'll never live a normal life. Have you found kind of in your experiences with healthcare or kind of trying to get support, have you found kind of doctors have been very kind of dismissive of?
Yeah. It's really hit and miss. Some doctors have been incredible, and they are the reason why I'm still here, because they've actually sat me down and listened to me. And I mean, I'd say doctors, the therapists and the clinicians that I have had have been amazing. But what I've found is a strange reluctance on the behalf of a lot of doctors. They don't want to diagnose you with borderline personality disorder because it's too difficult to treat. And suddenly on the NHS, then you're a number in a system that they can't get rid of quickly because you take years to recover. So it took a long time for me to push for that diagnosis and to get help. And when I first was diagnosed, I was living in the Midlands, and I ended up having, they told me I was having really bad suicidal ideations at the time. And I went to my doctor. I just drove there one day and I was like, I'm gonna do something bad. Like, I can't live like this. This is horrible, and I can't do this anymore. And he just said, oh, it'll be a year-long wait until you can see a psychotherapist. And I was like, so that's it then. Great. And he was just like, oh, your mum should be helping you. And I was like, I'm estranged from my family. I'm on
Mm.
my own. Like, that's the part of the reason for how I feel now is because of my past. I can't go and ask for help because from what's caused the trauma. So for me, then I had to use, so my boyfriend's parents live in London, and I ended up using their address and having to commute 2.5 hours to be able to get help because of the whole postcode lottery. So
So basically the system was a little better set up with the waiting times for.
not necessarily the waiting times, but for the fact that I felt I was being listened to more, and they had more kind of stopgaps in place. So for example, I was referred to a more specialist unit, which was the complex depression and anxiety service, rather than just through a GP. And they put me on a waiting list, which I think it ended up being just under a year. But there was a thing called the Recovery College where I could go and do essentially 1 or 2 days, or a course that would last 6 weeks. That was once a week, where you do like a mindfulness course, or you do a coping with stress course, or just something, anything to kind of put that filler in to feel like you were still making progress. And for me, that was also really important to be around other people who were also trying and also in a similar scenario, because like I said, I'd come from a background where people didn't discuss things. So then I'm thrown in the deep end. I'm like, oh my God, there's so many people here and we're all kind of alike. So yeah, for me, yeah, it was a postcode lottery and having to kind of be clever with how I found help. But I know there's a lot of people who don't have the stubbornness, I guess, that I
Mm.
do, where I refused to let the NHS say no to me. I just kept being like, you need to find me help. You need to find me help. I can't afford to go private. You have to find me help. And I think that's the problem, that, and how a lot of people get lost in the system because they just give up. And that's why then people think they can't live a normal life, because they get left. So it's really sad.
So once you were able to get help on the NHS, like um see therapists, or I'm
Mhm.
guessing was it more than just therapy, or what kind of help were you able to get?
Well, to start with, I actually saw a therapist through my uni at Nottingham Trent when I was first diagnosed with anxiety. And I had, I think I had 2 talking therapists there who were 6 weeks at a time, because you couldn't access more than that because that's all they could provide. Then when I'd moved back to the Midlands after I would finish uni and I was living with my friend's family, I then accessed more therapy and had another, I think 3 separate talking therapists there. And then, yeah, when I then finally got referred to London, or referred myself to London, that's when I did a thing called STEPS, which was the 20 weeks of emotion management, and the Recovery College. And then eventually, a few years later, I did something called ACT, which is acceptance and commitment therapy. And then I've just finished, like I said, dynamic interpersonal therapy. So it's been a long road of a lot of different things. But what I found really interesting is that not so people will sort of go, right, this therapy is best for this, but they also don't consider that each therapy kind of feeds onto another. So when you do more specialist therapies, I wouldn't have been able to do acceptance and commitment therapy when I was at the start of my therapy journey, because that is kind of like an add-on where once you've identified everything in talking therapy, then dealt with how to unlearn and relearn your emotions, that's when then you can start to learn how to live with things you don't have answers to. So for me, I describe therapy as almost kind of like qualifications for life, where, because I know a lot of people get scared of then finishing a set of therapy because they're like, oh my God, what am I going to do without my therapist? But when you start to look at it as, actually, I've been taught this thing. This is like my GCSE in emotions. And then this is my A level in how to accept things. You kind of learn that actually therapy is always there to dip in and out of. It's not a case of suddenly you're left and that's it for the rest of your life. You can learn extra skills on top. So it builds like a whole toolbox of life skills.
So did you always have positive experiences with therapists?
No. No. I'd say a good 80% is really positive and incredible. One therapist in particular, I can't even remember her name now, but she was just one of the talking therapists I'd had quite early on. And there's only so much talking you can do about the same stuff. Like when you start to identify what's wrong with you and what you've been through or what you need to talk about, that's great because you're like, this is the first time I've talked about this. When you get to the fourth person in and you're saying the same things, you're like, this isn't helping. This is actually just making me dwell on stuff. And I remember I'd gone to see this woman, and for some reason, it had changed to being at the hospital rather than at the GP surgery this session. And it was the hospital where the last time I'd been there before that, my dad had been in there having surgery. And so it brought back all these memories. And I was that leads back to the trauma thing. Suddenly you're in an environment where you feel that trauma again. And this therapist, she was quite an older woman. And I don't know if her views maybe were a bit outdated, but she started to tell me that I was angry with my dad and tell me that I was feeling certain ways. And I just completely lost it and left. And I was just like, do you know what? I can't do this. And I remember I phoned my doctor when I was in the car park and sobbed down the phone and was just like, I can't do this. I don't. And in that moment, because you trust that medical professional, you think they know everything. And then eventually you realize, oh, they're just people who do this job. Sometimes they're not going to be right for you. And the best way I've ever explained it in the past is it's like a relationship. You'll go through various relationships to learn things about yourself, and not all of them are going to be right for you. And then you'll find your right one. And therapists are kind of the same. So you have to go through them. Well, I don't go through relationships, but you know what I mean? You have to kind of learn more about yourself to then identify who you connect with. And I think it's really healthy to just sort of sit there and go, actually, this one doesn't work for me, but that doesn't make me a bad person. It doesn't mean they're a bad therapist. It's just we're not a good fit. So,
Okay. So as a person that's never had therapy, I find it interesting. You said basically essentially the therapist was telling you what do you feel. Is that a normal thing for therapy?
No. A therapist is, for me, my understanding is they're supposed to be a guide to identify with you how you feel and then how you can move forward. A therapist is not supposed to give their own opinions on stuff in terms of a personal aspect. So every other therapy I've done, I've never had someone go, this is how you feel. This is how you feel. They'll go, do you think maybe you're feeling this? And we can work on maybe this aspect of it. And it will be a much more comfortable environment rather than an attacking thing, which is very odd.
Sounds distressing.
Yeah.
Especially, like you said, you're in a vulnerable situation. You feel you're supposed to be able to trust this person, but at least you've had positive experiences.
Oh,
and
yeah.
everything has been negative, especially considering it's on the NHS. So, what are the actually, before I continue with therapy, I want to talk about medication. So I guess that may be a component of kind of managing mental health. Is that something you're on now? Have you been on medication before? Or
Currently, all I'm on is I take the lowest dose of Zopiclone, which is a sleeping tablet, but I only take it as and when needed. And basically, the reason for that is not that I can't sleep, it's that like I said, I get these trauma nightmares. So I know that if I've had a really intense emotional day or if I'm exhausted, I'm much more heightened to then having these nightmares, which then make me feel like I haven't slept. And they can be really horrible. And so, yeah, I just take that as and when needed, but that's all I'm currently on. I wouldn't hesitate to go back on antidepressants though, if I needed to. But in the past, when I was first diagnosed with anxiety in 2011, I went on citalopram, which is your real basic antidepressant. And I think that was then increased, started off on 10 milligrams, went up to 20, went up to 40. And it was good to start with, but then it was a combination of things. Although the depression was being dealt with, obviously I was undiagnosed with various other conditions. So they only thought I had anxiety and depression. And borderline personality disorder can't be treated with medication. It can be helped with the anxiety and depression side, but you're still being emotional and you're still having these outbursts and you still don't have that emotional language yet. You can't just take a tablet and be taught an emotional language, but it can make you give you that bounce pad to be able to learn, if that makes sense. So I'm less depressed, I'm less anxious, so then I can help myself more. But the issue is that I was still grieving. I was struggling with obviously access to the therapy and everything else. I didn't have home, all these things were going on. And so I hid in bed for ages and I wasn't exercising, I wasn't doing anything, I wasn't active, I wasn't going out. And so the weight piled on and I piled on probably about 4 stone and I became so miserable. And one of the side effects of these tablets was weight gain. However, I don't know if it was the tablets or it was because I just wasn't moving and I was eating more. So it swings and roundabouts. But I went back to the doctors and I said to them, look, I don't know if this is causing weight gain, but it's kind of counteracting the antidepressant side of it because now I'm just feeling really horrible and miserable in myself. And they switched me to venlafaxine, which I think I went up to 150 milligrams of that. And with that, the difference is, so don't quote me on this because I'm not a scientist or a doctor, so disclaimer. But my understanding is that citalopram is an SSRI, which it deals with building extra connections naturally in your brain to spread more serotonin around because you're lacking in serotonin, which is obviously the happy hormone. Again, please don't quote me on this. Someone is going to come along and explain this a lot better than me. Venlafaxine was an SNRI, which increased the natural connections to move more serotonin around naturally. And it also blocked negative receptors. So it added that extra element. It was like the next step of antidepressant to hopefully help me. That was really good for me. It was difficult to wean on and off. It took a lot, like you got a lot of nausea, you got a lot of brain zaps, and I had to work out ways around dealing with the fact it also caused me migraines. And I remember I went to my doctor and they said, and I said, look, I'm getting these awful migraines. What am I supposed to do? And they just said, well, you can either change antidepressant again or you can learn to deal with the migraines. And I was thinking, I can't deal with that nausea and stuff right now of weaning back on something else and the unknowing and not knowing whether I was going to pile more weight on and all this stuff. So I then had to I was taking vitamin B complex to try and deal with my migraines. And then I was taking ginger root tablets to try and deal with the antidepressant. And then I got switched because what I didn't realize that they didn't tell me was when you take a quick release antidepressant, it releases in your stomach. So it can make you feel really sick. If you get a prolonged release tablet, which is then more expensive on the NHS, which is why you get put on the quick release to start with. If you take the prolonged release, it releases in your intestines, so you don't get that sickness. So yeah, I was having to deal with the sickness from the tablets, and you get this weird kind of brain, like I said, brain zaps. You feel almost like you're underwater when you're going on and off them. So that was, I was probably on those altogether for about, let's say 5 years. And then I never intended on coming off them because for me, I just describe them as an antibiotic for your brain. There's nothing to be ashamed of with taking them. You wouldn't, so for example, if you're diabetic, you wouldn't just go, I'm not going to take my insulin because I'm going to ignore this. You just wouldn't do it. So why would you ignore that with your brain? So it was kind of a natural progression of then when I was going through therapy, because of the emotional intensity starting here, and then the antidepressants started to even it out. But then it's like they would come down too far. So then I'd have no emotional feelings. So I'd need to even that back. So I'd drop a dose of antidepressants to then be able to feel again, but then I'd feel too intense again. And then eventually it would even out again with the therapy. And then gradually it just so happened that it was just the right time to come off. And I started to replace what I needed with fitness.
Wow. In terms of medication, I think that's kind of it does sound a bit like you're playing a game almost, like I take this medication, but because of this medication, I need this medication, because of that, I need that. And
Yeah.
it kind of piles up. So do you feel you could have gone through the process without the medication and just the therapies, or do you feel you needed the medication as well?
For me, because I didn't have access to the right therapy and I didn't have the correct diagnoses at the time, I don't really know. But I know that in those times I needed that medication. Like there was no way would have been able to climb out of the hole I was in if I didn't have that bounce pad. That because the medication treated the initial everyday misery and sadness and anxiety and everything in order to get me to a place where I was then able to fully immerse myself in therapy. And I think had I entered therapy without trying to get a bit of stability, like basic stability in the form of medication, I don't think it had worked as much. So I'm a real advocate for both. I think if medication works for you, that's great. If it doesn't, it also doesn't matter. It's about finding, like you said, it's like playing a game. You have to find what medication fits with what therapy and what works for you and whether you have side effects and trying different tablets. And sometimes it takes a while. Sometimes you might find the right thing straight away. Yeah, it's a waiting game and a fun game of chess.